This conference will now be recorded.
Hello everyone, a warm welcome to CM Dental Academy. It's an online dental education platform in the field of dental surgery. We aim at delivering excellent quality online training programs and courses for dental students under the guidance of eminent mentors. The subjects will be covered in all the formats such as live lectures, descriptive notes, MCQs, and viva voce questions. So, what are you waiting for? Come, let's begin a journey towards success. For today's session, we'll be discussing muscles of mastication. Although many muscles, both in head and neck, are involved in mastication, the muscles of mastication is a collective term which is reserved mainly for the masseter, temporalis, medial, and lateral pterygoid muscles. All the muscles of mastication receive their innervation from the mandibular division of trigeminal nerve. Closely associated functionally with the muscles of mastication is the digastric muscle. The masseter and temporalis muscle lie on the superficial face, while the lateral and the medial pterygoid muscles lie deep within the infratemporal fossa. You can see here the picture of origin of masseter muscle as well as the insertion. Masseter consists of two overlapping heads, such as the superficial head, which arises from the zygomatic process of the maxilla and from the anterior two-thirds of the lower border of zygomatic arch. The deeper head arises from the deep surface of the zygomatic arch. Internally, the muscle has many tendinous septa that greatly increase the area for muscle attachment and which provide a multipinnate arrangement, thereby increasing its power. You can see here the origin and insertion of the masseter muscle on the ramus of the mandible. The superficial head passes downwards and backwards to insert into the lower half of the lateral surface of ramus, while the deep head, whose posterior fibers are more vertically oriented, inserts into the upper half of the lateral surface of the ramus, particularly over the coronoid process. The deep head of the masseter muscle, while that of the superficial head of the masseter. The muscles elevates the mandible and is primarily activated when grinding tough food. Indeed, the muscle exerts considerable power when the mandible is close to the centric occlusal position. On the basis of its fiber orientation, the posterior fibers of the deep head may have some retrusive capability for mandible. Temporalis. It is the largest muscle of mastication, takes origin from the floor of the temporal fossa of the lateral surface of the skull and from the overlying temporal fascia, and should thus be regarded as pympinate muscle. The attachment is limited above by the inferior temporal line. A picture shows the origin and insertion of the temporalis muscle. The origin of temporalis from the temporal fossa. The superior temporal line provides attachment to the temporal fascia. Here is the insertion of the temporalis on coronoid process, and anterior border of the ramus. From this wide origin, the fibers converge towards their insertion on the apex, the anterior and posterior borders, and the medial surface of the coronoid process. Indeed, the insertion extends down the anterior border of the ramus almost as far as the third molar tooth. The posterior fibers of the muscle pass horizontally forwards, while the anterior fibers pass vertically downwards onto the coronoid process. To reach the coronoid process, the muscle runs beneath the zygomatic arch. The anterior part, which runs vertical, it elevates the mandible, while the posterior one, the horizontal, that retracts and protrudes the mandible. In certain sites, the masseter and temporalis muscles are joined together. This is particularly so for the deep fibers of the deep head of the masseter and overlying temporalis muscle. The functional significance of this zygomatico-mandibular mass is unclear. Both the masseter and temporalis muscles are innervated by the branches of anterior division of mandibular nerve. They both receive the blood supply from the maxillary artery in the form of masseteric and deep temporal branches, the superficial temporal artery, like transverse facial and middle temporal branches, and for the masseter muscle, the facial artery. Pterygoids. To begin with the lateral pterygoid, this muscle lies in the roof of the infratemporal fossa and has essentially a horizontal alignment. It has two heads, the superior and in the inferior. Superior head is the upper head, which is small and arises from the infratemporal surface of the greater wing of the sphenoid bone. The inferior head being the lower head, it forms the bulk of the muscle and takes origin from the lateral surface of the lateral pterygoid plate of the sphenoid bone. You can see here the picture of a lateral and medial pterygoid muscles. The lateral pterygoid, both the heads pass backwards and outwards and appear to merge before their areas of insertion. The fibers of the superior head insert into the capsule and possibly the medial aspect of the anterior border of the intra-articular disc of temporomandibular joint, while the fibers of the inferior head of the lateral pterygoid muscle insert into the pterygoid fovea of the mandibular condyle. You can see here the upper head of the lateral pterygoid muscle, while that of the lower head of the lateral pterygoid arising from the lateral pterygoid plate. This being the pterygoid fovea. Here you can see clearly the upper and the lower heads of the lateral pterygoid. However, the precise insertions of the muscles are still controversial and have clinical relevance with regard to the temporomandibular joint disorders, which is of clinical significance, particularly the internal derangement, where the disc is displaced usually in an anteromedial position and the jaw may become locked. Such conditions may be associated with clicking joints, limited jaw movements, pain, and some have attributed variations in the attachment, and therefore the function of the superior head as an etiological factor in the disease. Functionally, the superior and inferior heads should be considered as two separate muscles. The inferior head is concerned with the mandibular protrusion, depression, and the lateral excursions, while that of the superior head is activated during mandibular retrusion, providing the controlled movements and during clenching of the mandible. Medial pterygoid. This muscle consists of two heads. The bulk of muscle arises as deep head from the medial surface of the lateral pterygoid plate of sphenoid bone. The smaller superficial head arises from the maxillary tuberosity and the neighboring part of the palatine bone. From these sites of origin, the fibers of medial pterygoid pass downwards, backwards, and laterally to insert into the roughened surface of the medial aspect of angle of mandible. Tendinous septa within the muscle increase the surface area for muscle attachment, providing a multi-pennate arrangement and therefore increasing the power the muscle can exert. The main function of this muscle is to elevate the mandible, but it also assists in lateral and protrusive movements. An accessory medial pterygoid muscle has been described as a separate slip of muscle close to the deep surface of the medial pterygoid. This takes origin from the base of the skull, close to the foramen oval, and merges with the deep head of the medial pterygoid. In the picture, you can see the lateral as well as the medial pterygoid muscles. Here you can see the superficial head of medial pterygoid. This is the superficial head of the medial pterygoid and the deep head of the medial pterygoid muscle. Its function is unknown. The masseter and medial pterygoid muscles together form a muscular sling that supports the mandible on the cranium. The medial pterygoid muscle is innervated by a branch of mandibular nerve that arises proximal to the division of mandibular nerve into anterior and posterior trunks. The lateral pterygoid receives its nerve supply from the anterior trunk. Both the muscles receive their blood supply as a muscular branches from the maxillary artery. This is just the collective information regarding the masseter, temporalis, lateral pterygoid, and the medial pterygoid, their origin, fiber insertion, and nerve supply as well as the blood supply. Just for a quick recap during your examination. The digastric, because of its functional association, the digastric muscle is described here, although it is usually not strictly classified as the muscle of mastication. It is located below the inferior border of the mandible and consists of an anterior and a posterior belly, which is connected by an intermediate tendon. Here you can see in the picture the posterior belly of the digastric muscle and the anterior belly of the digastric muscle, where hyoid puli for tendinous digastric bellies, which connects this. The posterior belly arises from the mastoid notch. Posterior belly arises from the mastoid notch. Immediately behind the mastoid process of the temporal bone, it passes downwards and forwards. It passes downwards and forwards towards the hyoid bone, where it becomes the digastric tendon. The digastric muscle passes through the insertion of styloid muscle and it is attached to the greater horn of the hyoid bone by a fibrous loop. The anterior belly of digastric muscle is attached to the digastric fossa or on the inferior border of the mandible. This is the anterior belly of the digastric muscle, which is attached on the inferior border of the mandible, which runs downwards and backwards to the digastric tendon. The digastric muscle depresses and retrudes the mandible, and it is involved in stabilizing the position of the hyoid bone and in the elevation of the hyoid during swallowing. The anterior belly of the digastric muscle is innervated by the mylohyoid branch of the mandibular division of the trigeminal nerve, while the posterior belly by the digastric branch of the facial nerve. This reflects the different embryological origins from first and second pharyngeal arch mesenchyme respectively. The anterior belly receives its blood supply from the facial artery and the posterior belly from the posterior auricular and occipital arteries. That's it about the muscles of mastication. Thank you.